Hi there, my name is Ailsa Villegas, and I'm going to tell you a little bit about some of the achievements of the Highland Green Health Partnership over the last 5 years. As today is World Therapeutic Gardening Day, I thought I would begin with the planting of our symbolic tree back at the Botanic Gardens. Along with 3 other partnership areas in Scotland at the time, Highland was awarded funding through Nature Scot and a programme of work called Our Natural Health Service. Our work commenced in November 2018 when I took on the role of Senior Development Officer based here within NHS Highland's Public Health team. The aim was to establish a cross-sectoral partnership working to connect people to the natural environment for the improved health and well-being. At that time, we had just 2 years to carry out our pilot work. However, a pandemic hit and the sheer size of the task ahead of us became apparent. So here we are, summarising our pilot work almost 5 years on. Today is a celebration. Too often we have our heads down delivering the work and don't take time to sit back and reflect on all we have achieved. And we don't take time to promote the good work to others. While the Our Natural Health Service funding is drawing to a close, it's certainly not the end of the project. We've gathered you all here today because there's an appetite to build on the momentum and continue the focus into the future. So why green health? As has already been touched on, keeping people healthier for longer will reduce pressures on the NHS. And there are also great cost and environmental benefits in looking to alternative treatments to pharmaceuticals. From an NHS perspective, the prescription of medicine accounts for about 11% of total health spend in the UK. That's £20 billion. But there's also benefits to the individual too. On average, a person spends just 3 hours per year with an NHS professional. And that leaves another 8,757 hours a year for self-care. So anything we can do to support that self-care and keep people healthier for longer is going to be a benefit to them and reduce pressure on the NHS. Highland has a wealth of experience around the table, and it's known that a lot of good work was already underway, but a partnership approach was put there to add value by sharing of knowledge, resources, money, and influence. It was recognised early on that while the NHS stood to benefit greatly from the delivery of nature-based prescription programmes, it was not solely the responsibility of the health service to implement these. Now, I'm not going to go into any great detail about the health benefits of connecting with nature. I think I would be preaching to the converted at this stage. Instead, the following presentation, I'm going to focus on how and why we did what we did and share some of the outcomes, as well as some of the challenges and lessons I learned as project officer. So the Highland Green Health Partnership, along with the other 3 in Scotland, worked within the above framework, covering both public health and health and social care, aiming to develop programmes for the population as a whole, as well as defined interventions for those with specific health needs. All of the partnerships share a sense of environmental guardianship in the work that they deliver, and we want people to enjoy nature, but we don't want our natural environment to be degraded or damaged as a result. All of the partnerships brought the public and health and social care sector together with the environmental sector, and these are 2 audiences that perhaps would not have communicated directly without these initiatives. Specifically in Highland, we had 5 main aims, and I've paraphrased them a little bit here just to fit with the presentation. But they were to identify our green health assets, coordinate partnership efforts, get more people to use the environment more regularly, reduce health inequalities through targeted activity, and to develop networks for shared learning. Before I go into these 5 aims, I just want to focus on what we mean when we say green health. In Highland, one of the earliest actions we did was to create some guidance so that we could have a shared understanding of what connecting with nature means. At times, it can be challenging in a rural place like Highland to convince people that this is an asset that can benefit them. The land, for many, is something to be worked and not a place to unwind. So, green health are activities that can take place anywhere nature can be engaged with, including inside the home, the garden, local park, or wild spaces. It can be active such as walking, or inactive, such as mindfulness, and can be part of an organised group or can be self-led. It extends beyond just physical activity to include social connection and mental well-being as well. So I'd like to start with our first aim, aim 1, identifying our green health assets. Community groups and activities offer a great opportunity to support people into nature-based therapies. Highland is vast, and one of our first exercises was to commission our local voluntary service to help us map and categorise what was available across Highland, with the aim of putting that onto an online directory. It was hoped that this directory could be used as a tool to assist health practitioners to refer patients. We currently have 282 activities represented on the directory across the 8 categories of green health, which are walking, cycling, gardening and growing, outdoor sports, outdoor volunteering, outdoor learning, creative arts, and relaxation and mindfulness. In addition to finding out what was out there, this also gave us a picture of where it was, when, for what audience, how it could be accessed, whether there was a cost involved, or were there any gaps in the services. And this exercise would have been very, very hard to achieve centrally in Highland and really relied on the local knowledge of the community organisations in each of the localities to help us paint a more accurate picture. Our second aim was about coordinating partnership efforts, and actually that online directory could never have taken place if it wasn't for the partnership working with High Life Highland and the delivery of a parallel project funded through LEADER aimed at hosting 27 community events across Highland in 2020. Now, unbeknownst to us, a global pandemic was round the corner, and it turned out to be the worst year to try and organise 27 community events. So instead, some of the money had to be diverted into more online materials. The website was created, a number of self-supporting resources were put on the website, and further funding was diverted to the distribution of green health home packs. The project was then extended into 2021, when a number of smaller scale events did manage to go ahead, albeit not with the numbers we anticipated, because there were still restrictions on social gatherings at that time. But overall, £180,000 was distributed through the High Life Highland Leader project. 14 organisations delivered 2,900 green health home packs. 22 organisations managed to deliver events to more than 2,000 people. 2,213 people participated in a virtual Hike the Highlands walk that was created, and 85% of participants surveyed indicated that green health activity had motivated them to take more outside exercise every day. And one of the quotes from a recipient of a green health home pack, they made recipients feel respected and valued as the content was tailored. There are probably too many partnership projects to list in any presentation for today, and I apologise if I didn't get a chance to mention yours here. But another one I wanted to just highlight under Aim 2 was Think Nature Health Walks, which was established with match funding from Smarter Choices, Smarter Places and the Pass for All Walking for Health Fund, together with funding through the Highland Green Health Partnership. We appointed Charlotte Mackenzie, who is based within HTSI and has been working for the last 3 years on delivering health walk coordinating services to the rural parts of Highland. So that's Sutherland, Caithness, Wester Ross and Skye and Lochaber. Over the course of her project, 255 new walk leaders have been trained. She's developed buggy walks, arthritis walks, collaborated with the High Life Highland Countryside Rangers on training for walk leaders on engaging with nature, has developed a number of creative walks, bilingual walks, and created a number of resources for the health walk groups. Moving now to Aim 3. getting more people to use the outdoor environment more regularly. The website and social media has been valuable in us getting our public messaging out there. In early 2022, we appointed a community engagement officer, Sophie Isaacson, to continue the social media and public messaging, as well as produce a monthly newsletter for our network. This week is Green Health Week, and it's no coincidence that we've decided to host the conference on this week. And I would encourage you to look at the hashtags that we've got on the display area and share your experiences from today. In addition to the website directory, we have a number of resources to help people. And in terms of our reach, the website has had about 13,000 annual views. And we also have a Facebook page, a Twitter account, and an Instagram account. The greatest engagement occurs during Green Health Week. And last year, during Green Health Week, we had about 7,000 post likes. So we're hoping this will grow year on year. On to aim number 4 in reducing health inequalities. We've now run 4 rounds of Green Health Small Grant funding through the partnership. 69 communities have been awarded small grants, amounting to a total of £144,000. Through the criteria of these small grants, we wanted to tackle health inequalities, and so a number of audiences and groups in particular have been targeted, and these are listed here. In addition to the small grant funding that we have directly distributed, we've been working with a number of partners and community groups and bringing in larger scale funds to support green health projects. Things like the Ideas Fund, the Community Mental Health and Wellbeing Fund, Heritage Lottery Funds, Smarter Choices, Smarter Places Fund, Green Recoveries Fund, the Cairngorm Trust and the Leader Funding. And overall, we've brought in an additional £1 million extra towards green health projects in Highland, and have written probably 30 letters of support for different groups and organisations. And that's excluding the current project in the Cairngorm National Park area, which is a very large scale Heritage Horizons project, a multi-million pound project that's just in its development phase at the moment. All of those funds are helping to direct projects where they're needed the most. Another part of tackling inequalities is through referral pathways. And I'd just like to share with you some of the work we've done with our community link workers. This is Lisa and Jodie from the Active Health Project who are with us today. Community link workers play a vital role in ensuring services reach those that need them the most. And the Active Health Project is a charity-based physical activity referral programme run by Velocity Cafe. They run either face-to-face or online consultations with people who are either referred by their GP or self-refer to their programme. And while an independent initiative funded in part through Smarter Choices, Smarter Places Fund and supported by NHS Highland Public Health, they've been working alongside us in integrating green health principles. Last year, they received 343 referrals and 70% of those went on to outdoor-based activities. The GP Practice Community Link Worker Programme was introduced in May 2022 and is led by Change Mental Health. 29 GP practices across Highland have a link worker who focus on wider issues such as social prescribing, which include issues around welfare and benefits. We've been working with the team to make them aware of the green health opportunities, resources and directory. It's a little bit early days for actual data because it's only just been the end of their first year running.
It is a bit early days for data, but one client who took up walking is feeling happier, has lost weight and her sleep has improved. Her short Warwick-Edinburgh Mental Wellbeing Scale has gone up from 16 when with the GP to 25 at the point when she was discharged from the community link worker in March.
On to aim 5 and developing networks and shared learning. There remain many parts of Highland without access to a community link worker or equivalent service, and in those cases the development of a local network played a key role in developing referral pathways. There's a lot of variety in the availability of activities across Highland, and the health needs of different communities can also vary. Actions need to be tailored to the local opportunities and needs. Multiple stakeholders should be involved in implementing green prescriptions, including the groups and activities receiving patients, the agencies supporting patients, and the health and social care practitioners referring patients. We created 4 pilot networks in Kyloch, Aviemore, Caithness and Lochaber to explore how we may develop green health referral pathways. From these, community guidance has been produced to assist other networks to explore the same. Community-led pathways will soon be trialled in Kinlochleven and Ullapool, and work is underway to integrate such networks alongside discussions around biodiversity and climate change. We've also done a lot of shared learning across the various stakeholders in Highland, and throughout the course of the project, some events are displayed in our atrium today. We've developed a toolkit from all our learning, and that now sits on our website. What we've found through the project has been echoed by findings from Edinburgh Napier University, who came and did a review of Green Health Partnerships in the second year, and found that a range of expertise is being developed, but there is no one-size-fits-all approach. So a menu-based prescription programme is sort of the way forward. These can be healthcare-led or community-led, water or land-based, group-led or independent, active or passive, at home on the doorstep or in dedicated green spaces, targeted or open to everyone, and seasonal or year-round. That last bullet point is quite an interesting learning point for us here in Highland, in that the summer season, when the weather is best and you would expect more people to be participating, is when the tourist season is at its busiest and there's less availability of volunteers to support community activities. So what were the challenges? These are the challenges as I see them, having been project officer. Service continuity is vulnerable in rural areas due to low volunteer turnover and short-term funding. Buy-in from healthcare staff is very variable and influenced by other competing priorities. The language and processes we can use often over-medicalise and put off both participants and providers. Measuring impact can be hard, particularly because we're working with third-party organisations, and it's a big ask for them to do all this data collection. And then once the data is collected, GDPR compliance and data sharing agreements remain a challenge between the NHS and the third sector. Support and coordination is essential to continued uptake, but it's spread too thin. And also managing expectations, what is achievable. I think this initiative has been unique in that almost everybody I speak to is enthusiastic and wants to do stuff. And we just need to be a bit realistic about what we can achieve with the funding that we have available and the staff resources that we have available. And we hate to disappoint, but sadly we can't do everything. So did we meet our aims? And this is a project officer view. First aim, identifying our green health assets. I believe, yes, we have a greater understanding of the groups out there and we've built relationships with them. We perhaps need to do a little bit more now understanding our green space assets as well. Second aim, coordinate partnership efforts. Again, yes, the partnership have collaborated well and they've added value. Third aim, get more people to use the outdoor environment more regularly. I put a possibly next to this. I think we've definitely created opportunity, but measuring impact has been harder and COVID has obviously had an influence. Slightly later on today, you'll have a presentation for Rich Mitchell where he will give you some more of the data that we've gathered across this and a bit more of an academic assessment than my project officer view. Have we reduced health inequalities through targeted activity? Again, I've put possibly. We have targeted action and created opportunity. We've avoided widening health inequalities. The work that we have done has been evaluated, but COVID has also had an influence in this way. Did we develop networks for shared learning? Yes, the established local networks are one of the strengths of the project. So to conclude, as our little willow tree has grown and flourished, so has our partnership. The tree is thriving, but it now sits in a new position at the Botanic Gardens. And just as it's shifted position, so is the partnership starting to shift position as the policy background shifts and changes around us. It's been a real joy to work on this project, and I would like to thank all the partners for helping us to get to where we are today. There is still so much more to do, and I know that in Kate's capable hands, following today's workshop, we have a commitment and a plan to move things forward. And I'm going to end with a quote, but it's not a famous quote. It's one that came from a resident of Highland that took part in our Pop It on a Postcard campaign during Green Health Week 2021. We asked the people of Highland what nature means to me, and 250 people took part. And this one individual said, "I appreciate the little things, the fresh air, the river canal and the Murray Firth, and I wish for all of us that we can unwind and release the tension. I heard it's hard for the brain to be anxious if we focus on gratitude, and I'm grateful for nature." So thank you very much for your time today, and I hope you enjoy the rest of the conference.